This is White Coat Black Sheep, where science gets curious and dogma gets uncomfortable. I'm Dr. Civelli. We talk physiology, evidence, and real-world medicine, plus all the questions you're not supposed to ask, but probably should. If you care about health and think there's a better way, welcome to our podcast. Hey, how's it going? I am Dr. Civelli. This is Sarah, Nurse Sarah. How are you? Tell me. How are you faring today? I know we've already had quite an event. We started with phase 1 clinical trials, and then
traveled over here.
You took several phone calls in between. We're always on call. We cover the entire valley. When people say, what kind of doctor am I struggle to answer that because I'm the most hybrid that you could possibly be. Would you agree?
Oh, yeah. Yeah, it does, definitely. You don't just give shots.
She said that because my mom she calls it the worst times, which they usually do. But I was like, Mom, do you know what I do? She, with confidence, just said, yeah, you give shots. So, no. So I'm primary care medicine trained. That's where I started. Doing family practice where we see anyone from, day 0 of life, we can deliver babies even, and then all the way up to elderly care. So there's different things and recommendations, guidelines that you would need to know if you can see every demographic. So that's where I started. And I specialized into functional medicine after working really in elderly care, seeing the last 3 decades of life just unfold before my eyes in a very treacherous way. So I met Sarah at the hospital. I was working at one of the local hospitals for acute rehab. And Sarah was doing an awesome job. You called with very intelligent questions, or you would know when not to call, which is awesome.
Never. I don't like to call the doctors.
Yeah, I mean, there's definitely a time to reach out, after you run through the standing orders. But things we came across, I think, just in the short time that I got to know you in that setting was I valued that you could assess emergent versus not relevant. Labs will give you reference ranges, and there's often, I don't know if you've ever looked at your labs, but there's like bolded MHCV on your CBC or MCV, mostly irrelevant things. In functional medicine, now that I'm here and specialized in this industry of optimization, there's a lot more relevance of those other things, but in general, especially in hospital medicine, we're just mostly looking at a very small cluster of things, like hemoglobin, platelets, GFR, creatinine, like those sort of things for your
little
kidney.
Soldiers.
Yes. Do you want to explain? I would love to hear.
I don't remember what it was that you were talking about, but there was a lot of white blood cells. And you said that when you see, what was it, the B
bands.
Well, the bands, but you put initials on it. But you were talking about it, and you're like, you consider these babies. You don't send babies off to war. You see these numbers, this is not okay.
So if you have an infection and you get just basic, boring blood work done by any doctor, outpatient or inpatient, and your infection is new, likely I'll see your white blood cell count higher than 12. We'll see it spike up, say it's in the 20s. Wow, shocking. Great, you have an infection. You just, from there, decide where's the infection and treat it. But if you stay in that chronic infectious state and your body is constantly running out of essentially immune cell fighters, and they have to shift and kick out the baby cells from the bone marrow. So those are bands, and that's what she's describing. Or if you were bleeding somewhere, usually most bleeding is from the gut. Ibuprofen, super common cause, see it all the time. But yeah, just a low-level bleed, and then your hemoglobin drops slowly, but eventually you're going to have to tap into your bone marrow because your peripheral system is going to run out. So those are the little baby blood cells bands that she's describing that are shifted or kicked out into the war zone, which is circulating the body. So,
and this is why she's an amazing doctor, because she'll sit there and explain things to where you can understand them. And I'm not even talking about the aspect of medical field. Like, even with your patients, you are like explaining to the point where you see them in that aha moment. Like, they understand.
Yeah, I think that's really a big part of what brought us here and what shifted me also into the space of optimizing, because I want people to understand what's going on with their body. I would love for them to be able to self-diagnose. Doctors, especially in what we do, because we don't take insurance. We're kind of in that luxury space in a sense. There's a lot of people who can't, they don't have time, they don't have money, they can't access doctors like a lot of other people can. So for that group, I mean, I would love to reach them, especially, or maybe you're just the busy working professional, workaholic, like probably me in a sense. I fit into that category my whole life. Like, going to the doctor, going to the dentist is for other people who are less busy. And especially when I was a resident doctor or med student, I didn't have the money to go. So it's those things that I really hope like we can bridge the gap into reaching people who maybe don't have access, or I guess also people who do access us, that they really walk away like, oh my gosh, I understand what's happening with my body. So anything that we can do to really bridge that is awesome. We have a whiteboard in our clinic. I like mad scientists draw out schematics, but I think it helps.
It's functional. It really is. Like, it helps your patients too.
Yeah. So we have a lot of cool questions, a lot of cool patients that come up. Lately though, I feel like just doing a lap at the gym, those conversations have been the most entertaining and possibly life-saving for some of the people. This one guy was taking testosterone and, a bunch of other things, to be honest. But he was showing me, like, he said, my leg hurts so bad. I was like, why does your leg hurt? And he was showing me, like, where he was injecting, essentially. And I'll try to like this guy better. And he was, like, going into the triangle that essentially all of your blood vessels funnel into the nerves. There's, we say vein, the vein, artery, and the nerve. So they all kind of funnel through right there at this space. And that's exactly where he was injecting. So you can cause a lot of harm by doing that. And it's really just that triangle right in the groin closest to the inner thigh. Don't go there. You have amazing deltoids you could just go intramuscular into, the front or the back. The back is the safest, back of the shoulder, to be clear. And also, in the glutes, upper outer quadrant, very, very safe. If the more like towards the mid region of the back, that's like sciatic nerve. Don't go there.
Yeah, I stay out to the outer edge.
And if you can imagine, I mean, you're poking a needle through the skin. Yeah, the risk of infection, but more times than not, people are like, you're piercing through structures.
Yes.
I mean, you're like, it's a small knife. Yeah. So, I mean, those are kind of the conversations that we've had lately. And then this other person, I don't know why it came up, but he was asking me about peptides and stuff. And then he mentioned, yeah, I used to have a heart condition. I was like, you used to?
It just went away?
You don't used to have diabetes. You don't used to have a heart condition. You have it. You have diabetes for life if you're diagnosed with it. You can have diet-controlled diabetes. You can have a well-controlled heart.
But it's always going to have
It's yours. So anyway, he has pulmonary hypertension. So he's like, yeah, I haven't been to the doctor in a while. He's a power lifter. I was like, do you want cardiac arrest? Do you want to just drop dead? Sudden cardiac death? And I was like, that's kind of like, and we were joking, but like, I'm like, no, you need to go in. So anyway, fast forward, the end of the conversation was like, I'm telling him, you need to get Cialis. you need to take Cialis every day. He's like, why do I need to take something for erectile dysfunction? I work fine. And I was like, I'm just telling you, this is going to save your life. So it could just be like, you have this heart condition that sucks. You're like, and in his case, I'm like, you're ignoring it completely, which feels either unintelligent and you just need to like really, really think about that, or it's depression. I was like, which one are you?
What was the answer?
He didn't answer that.
Oh.
But I bet you he's going to get Cialis. And in his case, that'll be life-saving.
And I think that's where people actually get a lot, like, confused
Mm-hmm.
because they hear a medication and they instantly think it's only for one thing.
Yes.
And it's not. There's many medications that can go for different things.
Yeah, that we use so the side effect happens. And the side effect is actually what we're using to our benefit, like finasteride or minoxidil. So hair loss, awesome. Take those two. Yeah, if you're a guy, it's going to help you with your prostate with making it smaller and helps with blood pressure, and you're going to grow some hair. Now, if you're a female taking those, it's a little different. You can, but I would just not probably take equivalent doses. Or if you're doing side by side, I mean, both of them would be on like baby doses because you don't want to give a female facial hair growth.
Why not? That can be attractive.
Mustache. Yes. Yeah, but if you're a girl and you're sprouting a beard, PCOS.
Yeah, no thanks.
Polycystic ovarian syndrome all day. Come see me if you have that. I can help you. It's such an easy fix. And honestly, that impacts your fertility.
Yeah, I feel like there's a lot of things that even women my age don't understand about hormones, stuff that you can actually give them that will make them not tired.
Yeah.
You just think, oh, it's age. Oh, I have kids.
Or it's normal.
Or it's normal. And it's like, it's not.
Mm-hmm.
And they actually have things for women. And my fear was cancer.
Mm-hmm.
I was always told you take hormone therapy, you get breast cancer.
Mm-hmm.
And so I always tried to stay away from that until I met you and I was educated on a whole bunch of stuff.
Where do you think you picked that up? Because, I mean, you're not the only one. I get asked that all the time and articles sent to me. And I'm like, no. Because I know the origin of it.
I heard it when I was a kid and it was going across TV on, like, it was like in 98.
Yeah.
2000. It was like huge. Hormones cause cancer. Like, so everyone's like, no hormone therapy. I mean, even my mom, who had a hysterectomy at a very, very young age, she didn't want to take any hormones, even though they suggested it because of the hysterectomy, because it was around the era that all that was going on. And she's like, I don't want to take the chance of cancer.
Yeah. I hate to just draw attention to this part, but guess who funded the science behind that? Not to point fingers at the men, but it was a multi-million-dollar, like in the hundreds of million-dollar level study with pharmaceutical companies. And for whatever reason, in science, they love to draw attention to this, that it was like a male-ran study for women hormones, and they concluded that it gives women cancer. And just this year, that was rescinded. It is false, completely false. It is debunked. So take your hormones, get your life back. A lot of people just feel off, and you don't have to.
No. I mean, the first night I took it, I felt like when I woke up the next morning, I actually felt like I slept.
Did you enjoy the sunshine?
I did. I felt like I was in heaven.
Yeah, it's like a mood lift, like a, oh my gosh, I didn't know that I could feel like this.
I mean, I was skeptical about it, like,
Of course, yeah.
but I was like, oh, let's just see if this works. I didn't go into it thinking, oh, this is going to do this, this, and this. I was actually the opposite. I'm like, this is a cream. This isn't going to help me. And then
Why? Because it's a cream, right?
Well, because it's a cream and Well, yeah, no, that's exactly what I thought. It's because it was a cream.
I love that you just said that too. You know what? Just since you mention it, when it comes to the delivery system of any medication, whether it's like a flower you pick from the field that has a known therapeutic benefit, or it's a nasal spray, a cream, a sublingual pouch similar to like a nicotine pouch, injection, subcu, any delivery format, it is effective. In fact, skin is a more effective delivery system than an oral pill, but people believe more in pills and shots, as my mom calls them.
Because
So,
the pills don't digest or what?
well, you're really the pharmacology of it is the bypass of the liver, or it goes to the liver. So the liver has everything to do with the bioactive form of any medication. But when it comes to, say, a topical cream, you're dumping it into the blood. So that's maybe the easiest way to think about it. But what's also interesting is you need the right lab that knows how to make the right product so it delivers as it should. Sometimes when people don't respond properly and they're getting a topical, which I know will dump into your blood, in that case, when I don't get the right outcome, I can always change what the hormone was mixed with, and use a compound pharmacist, and they will work with you to customize, because some people just don't absorb certain medications, and you only learn that by trial and error. It's not like you can do any test to say, oh, this person's going to respond well to grapeseed oil, or this person's going to do better with, whatever other options. There's so many options, but the pH has to be right, the delivery system for that person. But topicals are awesome. It worked for you. It works for the majority of people. So you felt results right away.
It was crazy. Yeah.
Yeah, that's cool.
It.
And in your case, you had the, I'll let you share since it's your information.
You can go ahead because there's so many, and I'm giving you permission.
Okay, we got the formal release. Thank you. So we did a combo with estradiol and estrone. So those are the two more bioactive estrogens, and then testosterone, low dose, and progesterone, low dose. Low dose meaning like 50 milligrams. You can also do like a separate oral progesterone, which is awesome for hair, nails, and sleep, which honestly, I'm going to probably start that myself. But yeah, doing a topical combo is great too. So it's really like personal preference. Some people like to inject theirs. You can do that too. I'm kind of tired of the needle.
Yeah, I'd rather just get the cream and click, and it's done. You just rub it into your skin, and it's done. No more needles.
It's funny, whenever we have husband and wife patient, clients, and then they're both on hormones, and then we give the product what the husband, it's just recommended for men to do the injections, testosterone, cypionate, whereas for female, we go more topical. It's just, I don't know, it's the starter kit of medicine. And so sometimes they're like, hey, how come she gets the topical cream? Why can't I just get a lotion? I'm like, because you're a dude, and you're probably going to be like more not as diligent with watching like how you transfer. Like you'll probably let your dog like lick your hands, and then now your dog is like juiced up on testosterone, or your kid. I don't know. I don't trust you as much.
Well, not only that, even with the weight loss, the peptides that we take, like with the husbands and wife. Well, we've been on it the same amount of time. Why is he skinnier? And I'm like, dude,
they do get jealous of each other. That is honestly, it's so funny. Yeah. Yeah, because the males definitely have a quicker response, and it just is genetic. It's not even fair. So I mean, sex differences for sure have a different response to hormone replacements or supplement replacements. And yeah, I think fun little nuances. Yeah. Kids, I do have parents that ask for their kids. There have been high school. So far, it has not been high school females, but definitely high school males. And they've asked for testosterone. Okay, I've said no. There's several reasons for that. But really, under the age of 25, So far, they've been like 17, 16-year-olds to 25. I don't think that you shouldn't take hormone replacement. Would it make you a superhuman? That's always the question. That's what people are wanting. I want that for myself, okay? Who doesn't want to be like, give me an edge. Give me a little edge.
Unstoppable.
Yeah, I want to be unstoppable. But you're always balancing risk and reward, right? So what am I doing? So I would temporarily juice them and enhance them. But would that impact something? Yes, it acts at the brain. That would suppress their fertility capacity. So at the, hypothalamus, pituitary, and you think about the whole axis is the way we speak of it. It's called the HPA axis. The hypothalamus, pituitary connects to your adrenals, connects to the gonads. And so all of that would be shut off. So then you get smaller testicles, and then that's called atrophy. And then if those are smaller, then they're not making as much testosterone. So then you create a future problem. And so they would, say they are not able to access the testosterone that they were typically supplementing, they're more screwed than, like, say, a 40-year-old male who just abruptly stops.
Yeah, I would never allow my son to do testosterone.
Yeah. Well, okay, so HCG, if you're going to do something, right? So what do we do? Because there's options. It doesn't mean that I love it, but it's peptides, so it's very like specific in its site of action. So HCG is something that a lot of people do, or there's over-the-counter supplements that are, they help to boost the testosterone. What are they actually doing? They're acting on the brain. So they're like, the term is bioregulators. So they stimulate the FSH and LH, which increases the signal to the testes, and the testes, Leydig cells, will make more testosterone that way. I don't see anything wrong with that. To each their own. Obviously, making your own of anything is the most ideal. But I do get this question a lot, and I'm sure people would not admit to asking it, or even, it it comes up. And as a doctor, I have to have an answer. And I know that if I don't give them a safe option, they're still going to go somewhere, probably black market, on Reddit or whatever. I'm on Reddit too, by the way. Because I like to see what is everybody across the board doing. But yeah, so they're going to go somewhere. So at least, let me check levels. Checking data more often is always my advice. If you're going to push any limits or push any envelope, at least look at your data more often. You don't get to do both. So if you're going to not check and not look at your vitals, not check the blood pressure, and push the envelope, that's not intelligent.
Yeah, very true.
Yeah, so I think, anyway, this is why we're here. And I would love to invite anybody to give us some questions. We are white coat, black sheep. We like to ask the questions that are hard or weird. I would love to have any interesting articles sent my way. And until next time, we will be here pressing the envelope.